So we're going to take a look now at the three types of neuromusculoskeletal pain. And essentially, we're looking at what's called pain mechanisms, or how the brain receives these danger signals. What's driving the pain? And we can break them down into three general categories. It's either the tissue driving the pain, the nerve itself driving the pain, or the whole system driving the pain. And how do we know what's what? How do we know which one is driving the pain? Well, there are some telltale signs, and researchers have looked and can say with decent certainty that if you see certain symptoms, you can say that one is driving the pain or the other. And as we'll discuss later on, it's generally a combination of all three, but one or two may be dominating. So when it comes to tissue pain, the technical term is called nociceptive pain. So think of this as a fresh ankle sprain. When you have a fresh ankle sprain, uh, what are the symptoms like? Well, they're localized. They're generally right where the injury happened. They're considered proportionate, meaning you move the ankle a little, it hurts a little. You move it a lot, it hurts a lot. It's that mechanical pain we were talking about where it changes with position, time of day, posturing. So yes, there's those aggravating and easing factors with this tissue pain. It sort of is intermittent, meaning comes and goes. It could be sharp with movement, dull and throbbing at rest. And generally, there's no tingling or numbing, burning or shooting or electric pain. So you just sprained your ankle. You see the picture there, it's some black and blue. You have this local proportionate pain. We can generally say that, okay, this is nociceptive. This is tissue pain. This is the tissue driving the pain or the danger signaling. The next category is nerve pain, technically called peripheral neuropathic. And so there are telltale signs of this. And when you think of this type of pain, think of sciatica. Think of that deep, achy feeling you get in your thigh, maybe going from your butt cheek down your thigh. Sometimes you get numbness or tingling. And so when you have the nerve tissue itself driving the danger signaling, you'll have that deep achiness. You'll have that um, numbness or tingling. When we see the word paresthesias, we think numbness, tingling, uh, pin pricking, pins and needles. And so some telltale signs, well, there was a history of a nerve injury or some kind of compromise. So also think of carpal tunnel syndrome, where you have that numbness or tingling into your thumb and the other two fingers next to the thumb. So that's compressing the nerve, a mechanical compromise. So when the nerve is driving the danger signaling, you're going to have some distinct patterns. So they call those dermatomes. So it's going down a specific pathway down a limb. And there are certain parts of the body where you can palpate or touch closely the nerves themselves. And if the pain's driven by the nerve, those areas may be tender. And there are certain movement tests. We look for what's called neurodynamics, but how specific nerves may be traveling. And as we do those tests, we can identify some of the potentially troubled nerves. So our third pain mechanism, is what I call system-wide. Technically, it's called nociplastic, or which is the newer term. It had been classically called central sensitization. And the word central is referring to the central nervous system, so the brain and the spinal cord. So a sensitization at the brain and spinal cord level, which we'll discuss later, driving system-wide pain, so that now it's not just felt like where the injury might have happened, like an ankle sprain. It's just felt all over. So think of commonly fibromyalgia, or CRPS, which stands for Complex Regional Pain Syndrome. That used to be called RSD, which was Reflex Sympathetic Dystrophy, fancy names. But basically, a system-wide response to threat. So what are the telltale signs if this is driving one's pain? Well, there's what they call disproportionate pain, meaning a light touch causes tremendous pain. That's what allodynia is. When a light touch, which generally wouldn't be considered a painful touch, triggers pain. There's also hyperalgesia. What does that mean? So something that should be a little painful, like a needle uh, injection, that's a little discomfort. But when you have system-wide pain, that little discomfort becomes very, very painful. We also see unpredictable patterns. Sometimes it's on my left side, sometimes it's on my right side. And back in the day, people might have been saying, oh, that person's faking it. Pain can't jump from left to right and right to left. But the neuroscience research shows, yes, when the system itself is sensitized, pain can travel and can go from right to left to right again. It's unpredictable. And what's often seen are what's called psychosocial issues. We'll talk a little more about them, but one of them is fear avoidance, which we've discussed already. We've touched on pain catastrophization, where we think worst case scenario, depression, anxiety, other factors too we'll discuss later. And the pain is diffuse non-anatomic, meaning it's not like you just sprained the ankle ligament and we're going to press that ligament and that's where the pain is and there's no pain anywhere else. With system-wide pain, it hurts here, there, almost everywhere. Again, this pain, all pain, is real. It's not just because we say the brain is making it, doesn't mean that it's fake. It doesn't mean it's all in your head. It's real pain. It's just we now know not all pain is the same. And different tissues will drive different pains. So the take home is the treatment that you need for your pain has to differ, will differ based on what mechanism is dominating. And so if you have a system-wide pain where the whole system is sensitized, well, treating that like you would an ankle sprain that's fresh will be ineffective. And so if you have nerve issues, and we'll discuss what strategy you'll use there, but you use the strategies for a tissue injury, you'll be ineffective. So understanding what is driving the pain will help you make a decision on treatment. So let's dig into tissue pain. So we've got the picture of an ankle sprain there. So a little nerd alert here. We're going to go a little deeper. So think about when all is well, you have no injury, we have a balance of all the different sensors. We mentioned we have trillions of these sensors that the nervous system has looking for information. These danger sensors, we call them technically nociceptors. And we mentioned that there's three general types. There's mechanical sensors, chemical sensors, and thermal sensors. And so when all is well, we have a good balance of these sensors, and they're waiting to send danger signals to the brain. Here's an amazing fact. These sensors only live for about 2 days, and then they have to be replaced. So we have on the screen some imagery. The top picture toward the right, not the nerd, but below that, is a nerve cell. And you'll sort of see toward the left is the cell body, and then the long cord is called the axon there. And so on the nerve and in tissue are all these little sensors. So the picture below that are the sensors. Technically, they're called ion channels. And basically, these channels open and close, allowing a charged particle in and out of the nerve. And remember that graph of the action potential? You'll see that toward the right. If enough of these sensors are triggered, meaning if these channels, if enough of them open up to allow that ion, that positively charged particle to enter the nerve, if enough of them come in at once and hit the threshold, the trigger is pulled, if you will, and the danger signal is sent up to the brain. So an amazing thing happens. That's how the body's working all the time. But now after injury, we have more sensitivity. Now, how we know we are more sensitive, it hurts to do the slightest thing after a fresh injury, like an ankle sprain. But what's literally happening? Well, dormant sensors are awakened. And our nervous system now changes the balance of sensors so that you have more movement sensors, more immune system sensors, more stress chemical sensors in the area, in the injured area, to protect it, to limit its movement. So, what's supposed to happen after an injury, the sensitivity comes about, but as tissues heal, those extra sensors are little by little removed. So if, let's say, in a small area you had 20 extra sensors when there used to be one, then you'll have, as the tissue heals, 10 extra. Tissue continues to heal, you keep moving, then you have the normal balance, normal ratio of sensors. That's how things are supposed to work and generally work when we injure and recover with no pain, no lasting pain. And maybe we could illustrate this back to that army base illustration. If an army base fears that there's going to be an attack, there's a warning, there's intelligence saying we may have an attack, it may put more soldiers on the perimeter. And basically that's what our body does. When it's under attack, if you will, with an injury, more soldiers, more sensors are activated so that we could be more aware of injury. Because when you first sprain an ankle, you're not supposed to move it too much that first day or two, depending on the extent of the injury. And so the body wants to know how much to do things, how much to restrict. More soldiers are put on it. But as the threat goes down, some of those soldiers are taken away. Going deeper now into nerve pain. So this is when we either literally injure a nerve, which is possible. Sometimes even in an ankle sprain, depending on the angle, we could rip some of what's called the peroneal nerve. But sometimes we have some other traumatic injuries, and the nerve itself might be injured or damaged. But sometimes the nerve starts sending danger signals, not because it was injured, but because it's near an injured area that's just not healing well. And what might prevent an injured area from healing well? Well, if we have other systemic diseases that are just compromising our healing in general, or we're not listening to our body, we're not providing a healthful healing environment, and we're keeping the area chronically inflamed. Well, in time, that inflammation can now irritate the nerve. So here, with nerve pain, the nerve itself is now generating these danger signals. So sometimes the nerve gets sensitized because it's being compressed. So think of carpal tunnel syndrome, where the wrist, whether you're at a computer or other activities, compressing the nerve, or let's say you're sitting too long and now your sciatic nerve is being compressed. Or other, your funny bone, which is at the elbow, is actually a nerve, and if you're compressing that too much. So if the nerve is being compressed for a length of time, it can start to be inflamed. And so now it's getting irritated, or the nearby tissue that's inflamed is now irritating the nerve itself, inflaming the nerve, and that will cause the nerve to lose some of its elasticity, something called fibrosis. And so now, again, danger signals coming from the nerve, and you have some of those tingling, numb feelings, a deep, achy feeling stemming from the nerve. But let's say you had an injury to the nerve. So there sometimes could be the stripping of a very protective coating. So if you look at the lower picture to the right with the red nerve cell, you see these blue tubes that are going along what's called the axon. That blue stuff is considered myelin. It's a very protective coating, just like the wires of an electrical wire have a plastic coating protecting the metal strands within. Basically, that myelin is the protective coating around a wire, around the nerve cell. And that myelin helps with the conduction of the nerve. But if that myelin is removed from injury or perhaps even from a disease like multiple sclerosis, HIV, uh, if that myelin is removed, that myelin does not grow back. That protective coating does not grow back, and in its place are more danger sensors. So essentially, you now have a new location, new real estate for more sensors, and there will always be more sensors there. And now they call that an abnormal impulse generating site. A site that was never intending to send an impulse now does send an impulse. And when that happens, our nerves fire not just up toward the brain, but downstream as well. And as it does that, it releases an inflammatory chemical called substance P, which then creates inflammation. So it's called neurogenic inflammation. It's inflammation that's driven or starts because of the nerve. And scientists believe too that even our thoughts and our worries can influence inflammation because our thoughts and worries, as we discussed earlier, are nerve impulses. And worry about an injury, constantly thinking about it, drives more messages down to those tissues, keeping that area swollen, hot, and sensitive. So continuing the army base illustration, imagine the perimeter fence around an army base is compromised. It's broken, and now there's a big hole there. Well, until it gets fixed, no doubt more soldiers are going to be placed at that hole, at that opening. And so just like the myelin being removed, now there's new real estate, more sensors are put there. So now there's more soldiers at the opening. But again, if there's been a threat, there's been a compromise to the perimeter of the army base, now there's more soldiers, but they're also on high alert. And so there's more chance of false alarms. So sometimes you're going to get a signal from the nerve, even though no true damage or injury was happening. And one last nerd alert point. In the upper right hand corner is a picture of a bundle of balloons on its side, and I'm calling it the dorsal root ganglion. So, what is that? So, right near the spinal cord is a collection of what's called the dorsal root ganglion. It's a collection of a bunch of the cell bodies of a nerve cell. So, above the balloons is one nerve cell. So the big fat body to the left, a bunch of them come together into what's called this ganglion. This basically this big collection of these bodies. That is one of the most sensitive spots in the human body. It's full of those ion channels, of those danger sensors, and it has a high collection of stress and inflammatory danger sensors. So when we do have a fresh back injury, it could be so painful, partly because of this very, very, very sensitive spot of our body called the dorsal root ganglion.